Hi, my name is Amanda Hansen, and today I will be sharing my research proposal for vitamin D deficiency and obesity in children. So my research question for this proposal is, does a year of vitamin D consumption to the recommended amount of 2,500 IU per day to 4,000 IU per day, dependent on the child's age, among Mexican children ranging from ages 6 to 12 years old who have been diagnosed with vitamin D deficiency and have a BMI above the 85th percentile, cause the child's BMI rating to decrease. The null hypothesis for this research is that Mexican children ranging from ages 6 to 12 who consume the adequate amount of vitamin D for their age will not have a reduction in their BMI percentile rating. And then the alternate hypothesis would be that Mexican children ranging from ages 6 to 12 who consume the adequate amount of vitamin D for their age will have a reduction in their BMI percentile rating. So you might be curious as to what the purpose of this study is. So the purpose of this research is to examine whether there is a strong relationship between vitamin D deficiency among children ages 6 to 12 years old and obesity. So you might be asking yourself, why is vitamin D a nutrient of interest? So vitamin D plays an important role in bone health, phosphorus and calcium metabolism, and potentially in immune functions and decreasing risk of chronic disease. However, there is a high prevalence of vitamin D deficiency among children ranging from ages 1 to 11 years old. In fact, in 2021, meta-analysis found that 15% of children had a vitamin D deficiency within the United States, and a majority of those children were overweight or obese. There's also a gap within the literature regarding vitamin D deficiency among this obese population. Some goals and objectives for this study is that this study is designed to examine whether the accurate consumption of vitamin D among children who have been diagnosed with vitamin D deficiency and have a BMI rating between the 85th and 95th percentile or above will reduce their BMI rating. The goal is to assess whether the accurate amount of vitamin D consumption will change the BMI rating among children in order to help reduce the increasing rate of obese and overweight children throughout the world. So among the literature thus far completed on vitamin D deficiency and obesity, as of 2014, the WHO data found that there was an estimated amount of 39% of the world's population suffered from excessive weight and 13% from obesity. Overweight and obesity had afflicted 43 million children under the age of 5. Also, the Johns Hopkins Medical Center found that 1 in 10 children are diagnosed with vitamin D deficiency in just the US alone. Vitamin D deficiency is also associated with many medical risks, including diabetes mellitus, arterial hypertension, heart failure, peripheral arterial disease, acute myocardial affraction, various forms of cancer, autoimmune and inflammatory diseases, decreased immune defenses, increased mortality, as well as rickets and poor bone strength and structure. It's important to look into the association between vitamin D deficiency and obesity because there's great controversy over the association. One of the most common explanations is that vitamin D plays an essential role in regulation of glucose homeostasis, insulin secretion mechanisms, and inflammation associated with obesity. However, 2 different studies were completed on the association, and both determined that more studies needed to be done to ensure the accuracy of the results. I apologize for butchering this name. Dr. Hayatikarn Nimitafong's study found that adipose tissues store and metabolize vitamin D, and expression levels of vitamin D metabolizing enzymes are known to be altered in obesity. And Dr. Luca Vranick's study found that vitamin D deficiency within obese people does not have an effect on bone tissue. However, it may affect other organs. Therefore, he concluded that low vitamin D concentration cannot yet be excluded as a cause of obesity. So for this study, we're going to be using children for our population, and we're going to be using children ranging from ages 6 to 12 years old because it's a minority. There's a gap within the literature regarding this age group. And we're going to be using children from 3 schools in low economic areas of Mexico City. Now, Mexico was chosen because it is among one of the 5 countries that contain a high population of children with vitamin D deficiency and obesity. We will also be using a sample size of 54 children. This was determined using a 2-tail a priori test with an effective size of 0.5, an error probability of 0.05, and a power of 0.95. The inclusion criteria includes children between ages 6 and 12 years old with a percentile rating between the 85th percentile and the 95th percentile or above, a blood concentration of 25 hydroxy vitamin D less than or equal to 30 milliliters, and written informed consent from their legal guardians. Exclusion criteria include chronic conditions, including allergies, gastrointestinal disorders, inflammatory diseases of connective tissue, diseases of kidney and liver, contradictions to administering vitamin D to the diet, disorders regarding bone metabolism, consumption or administration of any supplemental vitamin D, calcium, or phosphorus 3 months before the study, and anyone with a 25 hydroxy vitamin D blood concentration higher than 30 milliliters. So for the methods and procedures of this study, we will be taking children in to take their measurements of their height, weight, waist circumference, and 25 hydroxy vitamin D blood level. We will use 2 groups. Group 1 will contain children ranging from ages 6 to 8 years old, and they will be administered a 3,000 IU vitamin D gummy. And then group 2 will be children ranging from 9 to 12 years old, who will be administered a 4,000 IU vitamin D gummy. These gummies will be taken every day for a year, and parents will be given a weekly survey regarding the child's weekly consumption of the vitamin D foods as well, and if the child had any sunblock applied. Children will also participate in a Zoom interview with a researcher once a month for determination of their screen time. Then we will have them come back into the clinical setting, and we will measure their height, weight, waist circumference, and 25 hydroxy vitamin D blood concentration again. And this is just an example of the survey that will be given to the parents. We'll ask them if their child drank any milk, ate any cheese, yogurt, eggs, or fish that week, and they will just tell us how much the child ate, and then if there was sunblock applied and what SPF was used. So for the data analysis, we will be using both qualitative and quantitative analysis to determine the efficacy of this study. We will use IBM's SPSS software to analyze the measurements taken at the beginning and end of the study, and we will also use in vivo to classify and sort information that was found within the surveys and interviews throughout the study. So there's a great amount of significance with this research project because it examines a controversial topic of the association between vitamin D deficiency and obesity. It also contributes to the medical field in determining this association. So we will hope that by the end of this study, the researchers and doctors and nutritionists will be one step closer to determining the association between vitamin D and obesity. It's also important to examine all populations regarding this issue, especially populations with a vast amount of people suffering from vitamin D deficiency and obesity. And because children are our future, it's important to help them in determining the association between vitamin D deficiency and obesity so that we can potentially decrease this huge issue that we have of vitamin D deficiency and obesity among the adult population and the children population. We also will be resolving a gap within the literature because the age group that we are studying has not been studied a lot regarding this issue, and the population as well. Mexican children have not been studied. The researchers have not looked into vitamin D deficiency and obesity among Mexican adults or children because they have a vast amount of sun exposure throughout the year. So researchers are more interested in more northern places like Canada or Maine or northern states like Vermont, New Hampshire, that sort of thing, because there is a vast amount of vitamin D deficiency because there's only like real sun exposure for maybe 6 months out of the year. So it's important to look at all of the populations and resolve the gaps within the literature to come to a conclusion. Some limitations of this study are that children may choose not to forgo with the study because they are getting their blood drawn, and some people are against that. I personally am. I don't like getting my blood drawn, so it's understandable. They also the weekly survey might be altered because this study will be completed in the subject's home. So researchers aren't really watching the child consuming the vitamin D gummy or the parents filling out the survey. So there might be some lies in there, or even during the interview, there might be a lie. Because, again, this study is completed within the subject's home. So families may also just randomly drop out of the middle of the trial due to any possible reasoning, really. And the sample size is a bit small. So it would be helpful if there was a bigger sample size to study, but that might be a limitation within this study as well. And here's just a list of references for my literature review and the PowerPoint. I look forward to possibly presenting this proposal, and thank you for watching.